Carle combines clinical care, health insurance, and research in a way that solves problems today with an eye toward the future. Supported by a deep philanthropic spirit and dedicated to making life better for as many as possible.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HSHS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
Hi, I'm Keanne Armstrong. I'm your host for Being Well. Thanks so much for joining us today. We're going to be talking about a partnership between a local hospital and a local service provider in the Effingham area. And joining me today is Dr. Ryan Jennings. He's the Chief Medical Officer with HSHS St. Anthony's Memorial Hospital.
Correct.
And I also have Nikki Quandt, and you're the Executive Director of Heartland Human Services. So thanks so much for joining me today.
You're welcome.
Thank you as well.
Thanks for having us.
So we're talking about something that's really cool, a partnership between your service provider and the hospitals. So let's talk about what it is exactly and how it developed. Let's just start there.
Well, you know, Heartland has been a long-term provider in the community for our mental health needs. And like so many communities, we struggle tremendously with finding adequate resources for behavioral health issues, psychiatric services specifically. And they had a provider for many years, but unfortunately she had a new opportunity. And so we've had really no psychiatric coverage in Effingham for quite some time. So as we conduct, as the hospital, what we call the community health needs assessment, one of the items that always rises to the top is the need for behavioral health services. And so we said, you know, what makes the most sense here is to seek out the support of Heartland, who has the rest of the structure, all of the counseling services and all of those things available to them, but allow us then to help them to recruit a psychiatrist to provide services. But we ran into the same barrier everybody else does. You can't find a psychiatrist. And so we sought out another company that helps to provide telemedicine services. So rather than having a psychiatrist physically on site, what we did is arrange to provide a psychiatrist via telemedicine, which is really cool. And allows us to take advantage of a very scarce resource and still be able to serve our community in a way that hopefully is at least starting to meet the needs of the area.
Yeah, that's really cool, really neat. And I'm going to hold you right there for just a second, and I'm going to let you describe your service provider and all the different things that you provide at Heartland Human Services, and then we'll talk about that new approach that you have. So go ahead.
Heartland Human Services, like he said, has been in Effingham for 48 years. We are the Community Mental Health Center for Effingham County. We also accept patients from surrounding counties too. So we have several different programs. Probably the best known is our outpatient mental health and substance abuse services. So we do groups. If you have substance abuse issues, we do groups or individual therapy. Mental health therapists that handle anything from, you know, some minor depression issues to schizophrenia, all kinds of things in between. So we have several therapists. You see your therapist once a week. You might see your therapist once a month. Maybe you see your therapist, you know, twice a week for a while. We also, we have a really long building, so we tend to say one end of the building and the other end of the building. So on the other end of the building, we have our psychosocial rehabilitation program, which we have 3 residential facilities in Effingham where we have beds for 22 chronically mentally ill adults. So they live in the community, they reside in our facility, but they pay rent and they, you know, function just as normal the rest of us do. They come to the facility 4 days a week for treatment, and they go to groups, they go to therapy, they go to the Humane Society and volunteer. They go to lots of different places like that in the community. And then we also have a couple other programs. We have programs for geriatrics. So if you need help signing up for Medicare Part D program and you're not sure which one to do, we're the place to come for that. If your husband passed away and he's the one who took care of the bills and now you don't know how to pay your bills and balance your checkbook, we have people who can help you with those kinds of things. And our newest program, which we're really excited about, is called the First Responder Program. So the opioid epidemic has kind of taken over, and so we have a worker who provides case management services to those individuals. So if someone does overdose, then they can connect with us, and then we can get them set up with treatment and hopefully get them on a path to wellness as well.
My goodness, you cover a lot of areas.
We do a
Well, I
lot of
can
stuff.
see why this was a good partnership. So telemedicine, that's something that I haven't covered on this show. It's something brand new. So let's talk about how that came about and how it actually works. So do you want to start?
No, absolutely. It's great, really. I mean,
Yeah.
again, because you're talking about primarily using it in a couple of scenarios. One is where there's limited resources. For example, there's only so many psychiatrists, and so asking them to cover a larger geography without having to travel, basically.
Okay.
The other area where it's very, very useful is where I maybe don't have a certain level of expertise, and yet I can use telemedicine to tap into that. It looks like a Skype session. I mean, basically, you've got a physician on the television, and you interact with him real time, and you're able to communicate real time and kind of work through it just like you would as if he was sitting in the room. Our particular psychiatrist is actually out of Chicago area, and yet he's able to serve our community without traveling all the way to Effingham to do so. He's still able to order labs. He's still able to order testing. He's on staff at our hospital, but he's on staff as a telemedicine physician. We also use it in, again, areas where we have limited expertise. So if you're coming in with a stroke, we use telemedicine to connect to a neurologist and to help us make decisions about what the most appropriate treatment would be. We also use it in our level 2 nursery for newborn babies, where we, if we're not able to get somebody transferred quickly for whatever reason, that maybe the baby's not stable yet, we can actually tap into a neonatologist via telemedicine. We use it for critical care in adults. If somebody becomes ill and sicker than we anticipated, we're able to reach out to an intensivist via telemedicine, and allows patient, family, staff, et cetera, to really have a true, and they can see the patient. In fact, our robot allows them even to be able to listen to them with a stethoscope and things like that for medical patients.
Right.
Obviously, in the psychiatric world, that's not quite as critical.
Right.
But yeah, it's really a fascinating way to again take advantage of limited
sure.
resource and expertise and be able to spread that much more broadly.
Yeah, so cool. So with these other, I guess, ways of treating people that you were talking about outside of the psychiatry, do those happen in the hospital?
They do. That's
Okay.
all at the hospital.
All right.
And now the telemedicine, the behavioral health piece is all at Heartland, but the other things, are things that we use it for at the hospital, and it's amazing. I
Yeah.
mean, to be able to and to be able to see somebody. I mean, it's one thing to pick up the phone, but especially the younger generation.
Oh,
I'm
yeah.
considering myself part of the older generation, but they're very comfortable with Skype and
FaceTime and all these
FaceTime.
different things.
And so they're very comfortable speaking to a video monitor.
Yeah.
Virtually. Virtually,
Yeah.
and that doesn't even hit their radar as something unusual. So, it's tremendously beneficial.
So Nikki, who is the doctor, and tell us a little bit about him.
Dr. Tian Tai is his name. He is from Chicago, like Dr. Jennings said. We started with him in January, and since January we have seen 64 new patients, and we only have Dr. Tai 8 hours a week. So if you consider 8 hours a week and you've seen 64 new patients, that's pretty phenomenal.
Yeah.
In addition to 178 follow-up visits. So what Dr. Tai does is he likes to work collaboratively with our therapists. So if you want to come and see Dr. Tai, the way it works is you call, you make an appointment with a therapist, you have your mental health assessment and your treatment plan completed, we figure out what's going on, work together with the patient to determine what their needs are and what their wishes are, and if it seems appropriate to see Dr. Tai, then we can get them scheduled with him. He likes to work with the therapist, so the therapist and Dr. Tai stay in close contact with one another, typically via email. He's really good about that. Get on the schedule with him. The hospital provides a nurse, so Tammy is our nurse, and she comes in when Dr. Tai's on the TV, and she checks people in. She does everything that a normal nurse does when you go to the doctor, takes your blood pressure, your weight, your height, those kinds of things. And then she asks about medications and all of that. Then you go and you wait for Dr. Ty. You go into the room. There's a TV on the wall. He's typically ready for you. So you go and sit down in the chair. He can see you. You can see him. You talk to him, tell him what's going on. He asks questions. A first appointment is an hour, and then a follow-up appointment is 30 minutes. Like I said, he does want to work collaboratively with the therapist, which is something that not a lot of I won't say a lot, but not all psychiatrists want to do that. So it's really nice to have someone who wants the other point of view, because sometimes you get comfortable speaking with your therapist about things and then you see the doctor and you freeze up and you don't really know what to say. So it's nice that the therapist can provide him some input, and then he can get the other side of the story from the patient too, and then we can work together to figure out what the best route is. Like Dr. Jennings said, he does prescribe medication. Tammy typically takes care of all of the ordering of those things. He also orders labs if needed. Some medications that they're on, they need to have monthly lab work done, so he orders all of that, and Tammy gets him the results for that, and then he can change medications and things like that as needed. So it works out really well.
Yeah, absolutely. I'm glad you went on to explain the advantage of working with the therapist. That way, the two medical providers, I guess, locally and far away, they're sort of treating the patient together that way, and that's really cool coverage.
Yeah,
that
really
was
neat.
one of the key reasons we sought out the relationship with Heartland, because they had the structure.
Yeah.
They're just missing one little piece, and us being able to help to provide that really rounds it out. And there's no doubt that when you're talking about psychiatric illness, behavioral health issues in general, that a multidisciplinary team is critical. So
Absolutely.
Really great collaboration.
Yes, it sounds like it. So who does Dr. Ty see? Is it adults? Is it kids? What's the age range? And
he sees adults, so starting at age 18 and up. Probably our youngest is 18, and we go all the way into the 70s. So he has a wide range of patients. Right now he has about 70-ish patients. So we're getting at about capacity for him, so that he can have adequate time for follow-up and things like that. But in between appointments with him, typically a follow-up was in a month or so. In between that time, you would have seen your therapist a couple of times too, so they're also checking in with you to make sure things are going well. So it's nice that he knows that if we have a problem or we see something going on with a patient, we can let him know, and then he'll say, yep, I want to see them again, schedule them this week, we need to do something about that. So it works out really well.
Okay. So if somebody is watching out there now and they're thinking, well, this is something that I think would be beneficial for me, how do they seek out? Do they go to a primary care physician to get a referral? How does this work?
They can call Heartland directly. Our number is 217-347-7179. They would need to do an intake and get an appointment with a therapist. Our intakes person, her name is Amy, so that's probably the first person that they would talk with, and then Amy would get them set up with an appointment, and then they come in, see their therapist a time or two, and then we'd get them scheduled with Dr. Ty as quickly as we could.
Okay. Is there a difference, whoever wants to answer this, is there a difference in maybe health coverage for telemedicine versus seeing someone in person?
So actually, it is covered now. It didn't used to have coverage at all, and Medicare over the last several years, and Medicare tends to be the one that kind of sets the standard that everybody else follows. Medicare has identified various services that it's now willing to pay for telemedicine services, and psychiatric care was one of the very first because of exactly the shortage that we mentioned earlier. So there's two components to it. There's a professional fee, just like if you saw a doctor in the office, so there's a professional fee component, and then there is a minor charge for the use of the technology, and that also is reimbursed usually through insurers. Medicare does pay for that. It's what's called an origination fee, but so there's a minor fee there, but really cost is not the barrier. We want to be serving the community. This wasn't put out there to be a money-making service. This was put out to be a community service, and again, critically important why we collaborated with Heartland, to be that service provider. So
to meet a need.
To meet a need, exactly. This is something that we look at as a community benefit. And for us, hopefully, this reduces patients that reach the point of crisis. And if we do this well, hopefully there's a resource in the community where they can go find help before they reach crisis. But unfortunately, unfortunately, that still happens. And so, if someone is to the point of thinking about suicide or, harming themselves, others, then the emergency room is still the right place. But hopefully we can help to curb the number of patients that we see reaching that far into their journey around their illness and be able to head it off at the pass, basically.
Right.
So.
Yeah. So also mentioning the emergency room, if that need is there, go directly there. Is there a crisis hotline through your?
We do. It's 217-342-5504. And then that is answered live, and typically we have an answering service that answers, and then they call the worker and they'll call you right back. So yeah, it happens pretty quickly. And like Dr. Jennings said, our goal is to prevent those ER visits as much as possible.
Absolutely.
And we have seen over the last 6-ish months that we've done that a few times.
Really?
And
That's great.
And it's great. We have one person who likes to go to the ER a lot, and now she's starting to come to Heartland more and more often, which is fine because that prevents the ER staff from being tied up with things that they don't need to worry about for that day. So it has been really beneficial, and I think the more it gets out there and the more hours that we have with the doctor, that we'll find that the ER is freed up hopefully a lot more.
Yeah. So what are the hours for Heartland Human Services? Are they extended?
Our hours are typically 8 to 5. We
Okay.
do have several therapists that work in the evenings. So we typically have someone there until 8 o'clock at night. With crisis, it's 24 hours a day, so you can always call the crisis line and someone will answer. Dr. Ty's hours are Tuesdays and Thursdays from 1 to 5. And like Dr. Jennings said, hopefully we'll be expanding those sometime in the near future.
Let's talk about that a little bit. Are there plans to expand?
Yes, actually we're continuing to work with the company that Dr. Ty is associated with as well to hopefully either expand his hours, identify another provider. What I would really like to see is hopefully a provider that would also be able to see pediatrics because the
Such a
need for some,
need.
it's huge. And I understand Dr. Ty's doesn't see kids, that's okay, but we recognize that that's still a very much an unmet need, and so hopefully as we expand the services, pediatric services will be the next big thing to tackle.
Yeah, sure. So let's talk a little bit about these doctor visits. What if the doctor thinks that more tests needs to be ordered? How does that work? Do they send them back over to the hospital? How does that work?
Yeah. Dr. Ty is in very close contact with his nurse. She's typically not in the room during the sessions, but if a patient feels like they would be more comfortable with her in there, then Tammy does sit in the room. A lot of times Dr. Ty will email her or text her and say, hey, the patient seems a little bit uncomfortable. I just asked her if she'd like you to come in, so Tammy will go in and sit down with them. But what he does is he works through Tammy, so he orders all of the labs and then she fills out the paperwork and then sends it, and they go to typically Convenient Care or somewhere at St. Anthony to get
their
just
their
like a
choice.
regular-
I mean,
right.
he's
Yeah.
able to order wherever.
Wherever.
and so the patient can choose wherever they want their service. But we'd like them to use St. Anthony's.
Yeah. Well, of course.
Most do.
Right. So explain what it maybe looks like. If I'm sitting at home watching TV, I'm hearing about this, I'm thinking telemedicine. Is it, does it look like a control room? Is it an iPad? Is it a TV screen? Like, what does it actually look like? And is it more of an office space, or does it look like where you would go in for a medical exam?
It's more of an office space. So what we did is we just converted one of our therapy rooms into the telemedicine room. So you walk in and there's 2 leather type chairs sitting there, and then there's a TV on the wall, probably 42 inches,
Maybe that's size.
Maybe that
Not
size,
quite
yeah,
that big,
something like that. You walk in, you sit down. Dr. Ty is typically on the TV already, and then you sit, and he sees about this much of you, waist up. And there's a webcam and a microphone right next to you, and so you just speak normally like we are, and he can hear you, and you can hear him, and it's just a normal room.
Yeah.
Not much to it. But
So you said this is for adults 18 and older. What has the reaction been from patients? Has it changed? Is it different? Is it versus age or anything like that?
Really, everyone is super pleased with it. And I actually have some survey results that we just received the other day. We started in May gathering these. After your appointment, you have the option to do a survey, and I think it's 2 questions essentially, and most patients have opted to do it. So we have 60 survey results between May and July, and they ask about your experience with the service and then also your experience with the doctor. So experience with the service, we've scored a 9.75 out of 10. those 60 surveys, and the doctor has received 10 out of 10
Oh my
for all
goodness.
60. Yeah, so he's phenomenal. We cannot say enough good things about Dr. Ty. I don't even know if he knows about those results yet because we just got them the other day. So when I saw that, the company that Dr. Jennings referred to that he works for, they even said in the email, "This is phenomenal. Like this doesn't happen." So the patients have been really excited about it. Some of them are nervous at first when they come because it's their first experience with it, but Tammy is great at setting their minds at ease, and the therapists have prepared them for it, and sometimes they'll have them see the room beforehand and this is what it looks like and that kind of thing. So we do our best to ease their anxiety before they get there, but Tammy does a good job with that, and like I said, she'll sit in with them if needed and things like that. So
that's good.
Yeah, it's been great.
So we've talked a lot about the positives and bringing this to the community, meeting a need. Were there any difficulties or things that you needed to work through, as usually there is with anything that's new?
No,
Right.
not at all.
Nothing went
Nothing.
perfect.
It's been great.
It's flawless.
Right.
Yeah.
Truly, the biggest barrier is just finding a provider. I mean,
Yeah,
we've worked on this for 6 months, maybe
More
longer
than
than that, before
Yeah.
we were able to finally get a provider that was willing to take it on. So that's been the biggest hurdle. Then there's some IT stuff that had to be
Right.
worked through, because I mean, you do have to have some significant bandwidth to be able to not be robotic, you know?
Right. Yeah.
And so there was a little bit of that,
Yeah.
and we're still, kind of tweaking the workflow and figuring out how to register people, and of course, insurance prior authorization and all that stuff is becoming a bigger and bigger headache for all of us.
Yeah.
So, but we're working through it, and most importantly, we've decided that nothing's a barrier. That we're going to go forward with this and continue to meet the need. And if there's something to work out on the back end later, we'll fix it later. In the meantime, we've got to be able to provide the service immediately.
Yeah, it was what I was wondering. Technology is great when it works,
When it
but
works.
here, even at the
Yeah.
station, when it doesn't, it kind of throws things off a little
Absolutely.
Yeah, and we did have some struggles with that at the beginning, and Dr. Ty was great. He would just talk to people over the phone when they did look like robots. He would see them, but he would pick up the phone and talk to them instead, because we were having some issues with that.
I guess you have
so,
that too, don't you?
Yeah. So thankfully we had telephones too, but yeah, I think we've worked out most of the bugs at this point, and things are going smoothly.
Yeah.
So.
So is this the first time for a collaboration like this between the hospital and Heartland Human Services?
To my
knowledge, yeah. I
Yeah.
mean, they've always been strong partners. They've always served, our ED for crisis and things like that as well. But a true collaboration at this
Yeah.
level it is a unique thing, and just perfect. I mean, they had the structure. They just need a little bit of help.
A little bit,
and
yeah.
we're glad to provide that.
We're blessed
so
to have
neat.
them.
Yeah, it sounds really neat. Such a neat collaboration. We have just a couple of minutes left. We've gone through a lot of different things. Is there anything that we haven't talked about yet that you want to get information out to the viewers that comes to mind? Can you think of anything? Put you on the spot?
Oh, on the spot.
Yeah.
Really just recognizing, how serious these illnesses are.
Yes.
And you mentioned primary care physician earlier, and certainly, that's a great resource. And when we're looking at the very limited resources of psychiatric services, if you don't have a primary care physician, please seek one out, because they can begin to offer treatments, and they can collaborate with Heartland as well, with the counseling services and all those other aspects, and the primary care physician can manage many of the medications. I mean, fortunately, most of the medications are very, very safe and very effective, but sometimes it's out of my league. I've tried a couple things on you. I need help. I need an expert, just like I would treat cholesterol, and then at some point go, you know what, we've tried 3 medicines, it's not getting there, let's send you to the cardiologist to figure out what to do. Exactly the same type of thing. So I wouldn't want to disregard the role of the primary care physician in this whole thing in any way, because they are obviously managing the lion's share of behavioral health concerns, and so that's a first stop always, and then hopefully we can supplement what they're able to offer with the services of Heartland, and then occasionally the need for an actual psychiatrist.
Okay. Would you like to add anything onto that?
I think my final words would just be that Dr. Jennings has been a champion for us to get this process started. So we are truly blessed to have St. Anthony in our court in Effingham. They've done amazing things for our community, and so we truly are blessed to have them and their support and financial backing for this, because otherwise the community would not have this service. So
Absolutely. Well, this has been a really cool topic to talk about. I found it interesting, and I think it's really neat that the collaborations, the partnerships are meeting the needs of the communities in the region. So it's been really cool talking to you. Thanks for coming in today.
Thank you.
Thank you for having us.
Yeah,
It's great
absolutely.
to see you again.
Great to see you as well. And thank you so much for watching this episode of Being Well. If you need more information, tune into our website at weiu.net, and we'll see you next time.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HSHS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Carl combines clinical care, health insurance, and research in a way that solves problems today with an eye toward the future. Supported by a deep philanthropic spirit and dedicated to making life better for as many as possible.